The idea behind the Obama plan was to try to make it illegal for insurance companies to discriminate based on pre-existing conditions. Now, that's impossible because insurance is all about discriminating based on pre-existing conditions. If you can't discriminate based on pre-existing conditions, then you can't have insurance. It's like I can't buy my fire insurance when my house is on fire. If you can do that, then no one would buy fire insurance until their house was on fire, which means the insurance companies wouldn't have any money to pay claims because they wouldn't have collected premiums from all the people whose houses didn't burn down. Right. So in health insurance, if you tell people that you can wait until you get a really bad disease and then buy health insurance, then no healthy people are going to want the insurance. Why bother? And so the minute you say that insurance companies can't discriminate against pre-existing conditions, you have to require everybody to buy insurance. And the penalty for not buying it has to be high enough so that there's not an incentive to just pay the penalty over the insurance. And so if the penalty is only $750 a year, and by paying $750 a year, I can save $5,000 or $10,000 a year on insurance, I'm going to pay the penalty. So what the government is going to have to do to keep the industry viable is dramatically increase that penalty. But, you know, the real reform that we need in health insurance in America is market-based. We have to ask the question, why is health insurance so expensive in the first place? Why isn't it getting cheaper? Why doesn't capitalism work in healthcare the way it works in other areas? And the reason is because the government won't let it work. The government has interfered. The biggest problem with insurance and healthcare is our tax code. The tax code says that if your employer pays you wages, you've got to pay income taxes on it. But to the extent that he can give you some of those wages in the form of health insurance, it's tax-free. So now you have employees wanting their employers to pay for their health care through their insurance. But that's not what insurance is for. Insurance is for major catastrophic problems that are unlikely to happen so that the premiums are low and you're covered in the event of, you know, $1 million bill because you get cancer. But you're supposed to pay for routine medical procedures like the flu, like a sprained ankle, you know, like childbirth. These type of things should be covered out of pocket through savings where individuals shop around and have some incentive to keep prices in check. And now we have these third-party payers, and we've made it so expensive, somebody walks into the doctor for a checkup, and now the doctor has 3 or 4 people filing insurance forms because nobody pays for anything in cash. We've made it so inefficient that prices are going through the roof. And, of course, there are other things that we can do. We can allow insurance companies to compete across state lines. We can allow international competition. We can stop the government from mandating that insurance companies cover all sorts of things that people don't really want coverage for. We're forcing people to buy insurance that they don't want and they don't need, and that runs up the price. We need real meaningful malpractice reform and tort reform so that malpractice premiums can come down, so that more doctors don't have to retire because they can't afford the malpractice. And so many doctors don't waste so much time and money on unnecessary procedures, not because the patient needs them, but because the lawyers require them so that they don't get sued.
Right. Right, and also I think encouraging age discrimination because, of course, the younger you are when you start buying health insurance, like life insurance, the cheaper it's going to be. But there's some legislation which prevents discrimination by age, which is great for the older people because they get subsidized health care, but it really does is a disincentive for the younger people to get on when it's cheaper.
The only way that young people are going to buy insurance is if you make it inexpensive. And the beauty is it should be inexpensive, right? Because young people are not going to get sick. They're not going to need it, so the premiums can be low. The only insurance that somebody who's young needs is a catastrophic plan. He can have a $5,000 deductible, but he needs coverage in case he gets a brain tumor, right. You know, in case something really bad happens. But you know what? The odds of that happening are very slim. It's not going to happen to most people. So insurance can work because they can collect a lot of premiums from people where they're never going to put in a claim. But, you know, if you keep all those young people out of insurance because you drive up the cost, then the only people who want insurance are the people who need it. And now they can't get it because then it's too expensive.